So actually, they asked me to present two talks. One is about the cross-linking effect measured by the CorVis, and then the evaluation of corneal biomechanics after refractive surgery. I would like to apologize for being late, but we were catch up in longer surgery than expected, so I do apologize for being late. Okay, so I am going to, well, this is my financial disclosure. I'm happy to be part of the Oculus family since a few years. And I think it's very important, before we speak about cross-linking and how to measure the effect of cross-linking, to speak about IOP measurement. But why is this the case? The CorVis is a tonometer, and all tonometers are based on a very simple concept, which is you apply a force to a ball with an internal pressure, and then you evaluate the resistance to deformation, which is dependent on pressure. And you correlate the deformation to pressure. While this concept is correct, and high pressure causes small deformation, low pressure and causes large deformation. But it's also true that large thickness will cause small deformation, and stiff material will cause small deformation. At the same time, small thickness will cause large deformation, and soft material will cause large deformation. Why is this so important? Because we can have the same deformation, which will be seen by the CorVis, that we have to remember this is a Scheinflug camera with a non-contact tonometer, and that can be caused by a small pressure and a stiff cornea, or a high pressure and a soft cornea, or any combination. So it's difficult if you don't do anything before to separate pressure from stiffness. So at the beginning of our journey, we were first measuring pressure, then thickness, and then biomechanics. So we had to work on this. So the first step we did before going to the CBI, the TBI, was to evaluate the normative values with regards to pachymetry and intraocular pressure. And this was done in 2016. At the same time, Professor El Sheikh from Liverpool University, where I had the pleasure to work for a few years, developed a new equation that is called BIOP, that is able to compensate for age, because we know that the cornea over time gets stiffer, pachymetry and biomechanics. So this step was very important, because if you then know how to measure correctly intraocular pressure, then you can finally evaluate the corneal biomechanics and then diagnose for keratoconus. So we proved that with the CBI, that is a combined index based on biomechanics, we were able to separate very effectively healthy and keratoconus patient, and also it's good in subclinical cases. As Renato has said, we were very proud to receive this prize by the American Academy and the International Society of Refractive Surgery, and this is actually an honor for the whole group. But now we need to speak about cross-linking. If we speak about cross-linking, we speak about stiffness. And I like to start, as in the Bible, in the beginning, there was stress strain. So when we started cross-linking back in the early 2000s, we were measuring the corneal stiffness actually by pulling the cornea. Obviously, we cannot do it in vivo. So what did we do so far? Well, in the first months, it is known for everybody that is doing cross-linking that the pachymetry gets worse, visual acuity gets worse, curvature is worse, and aberrations are worse. So if you're used to work with cross-linking, and maybe you have also residents working with you, they will come to you asking for help. They will say, Dr. Vinciguera, what did you do? The patient is worse, the curvature is worse, maybe we have to do cross-linking again. And then you go to them with the knowledge that they will get better, say, don't worry, because best corrected visual acuity, sim case, aberration, they will get better over time. But the reality is that you don't know. This is just an average. There are some patients that will not go in this way. Then we started evaluation the demarcation line. The demarcation line is a whitish line that we see in the anterior segment OCT. And then we know that it's correlated with the depth. Is it correlated with the effect? Not really. There are some studies, particularly this one that is very nice, published in Graves, that showed no correlation between the depth of the demarcation line and any of the parameters that we evaluate after cross-linking, such as visual acuity, change in Kmax, So if the demarcation line is deep, that does not mean that the patient will go well. So why don't we go to basics? This is what I thought a couple of years ago when I was working in Liverpool. Biomechanical assessment, what we need. And this is what also Renato showed. We are both fans of Star Wars. So as you can see, we do like using this figure. But this is to show you that if we are stiffening the cornea, why should we measure something else rather than the stiffening? So this is what we do. We use the CorVis ST. And I'm not sure if Renato showed you in details the phases of the cornea, but I think it's worth explaining. So what we do is we hit the cornea with an air pulse. The air pulse will deform the cornea. So first the deformer will go from the convex case, when it's naturally convex, to being applanated, then it will get concave, and then it will go back. From this measurement, we can have many parameters. It's very important to know that the shape parameters, meaning the curvature of the cornea, rather than the deformation amplitude, are very much correlated with the biomechanics. So we wanted to see, in the first month, are we able to see a change in corneal stiffness, which we were not able to see with the ocular response analysis? So we did a very simple study. We took 34 eyes. We did AP-off cross-linking for progressive keratoconus, and we did the CorVis and Pentacam the day of the surgery and 1 month post. It's very important that we stop for one moment. There has been some studies after hours in which they said we cannot see this effect. It's important to explain that if you do not do the CorVis and the CorVis the day of the surgery or maximum 1-2 weeks before and 1 month post, you will not see this. So if you do the CorVis 3 months before and then 3 months after, you might not see the change. And this is because the changes in corneal stiffness are masked by the changes in viscoelasticity. So do it in the week of the surgery and 1 month post. So our result that we were able to see a significant rise in stiffness. This is demonstrated by an increase of stiffness parameter that was invented by Cinzia Roberts, which makes sense. If the stiffness is higher, the stiffness parameter will go more and higher. And then we have a decrease of inverse concave radius. Actually, it's inverse integrated radius. Let's stop with this one. So you have to imagine that if you have a cornea that is stiffer, it will deformate less. But also, the shape of the concavity will be smaller. So it will be more flat. If it is flatter, then it means that the radius of deformation is smaller, is bigger, which means that if you do 1 over the radius, it means that when it gets stiffer, the inverse concave radius will get smaller. I know it's complex to remember. We usually describe the inverse concave radius because when the cornea was softer, the inverse concave radius will go higher. So, as we said, the beginning we measured stress strain, but that was measured in ex vivo, sorry. So now we are finally able to measure the stress strain in vivo. And this is a new study that I want to show you. It's a very complex index that we published all together in collaboration with Liverpool University. So basically, if you are aware, if you know how the stress strain curve is, as you can see, normally this is how it is. It has a very strange shape. So it's impossible to describe the whole curve in one point because this point has a different shape and slope compared to this one because it's based on the stress. What we did is we created an index that is able to describe the whole curve, and this is the stress strain curve. So we have seen that the stress strain index is correlated with age, which is good because obviously if it is correlated with age, then it means that it's correlated with the stiffness because we know that stiffness gets higher over time. It's independent on IOP and independent on thickness, which is also good because if it is stress strain, which measures the exact stiffness of the cornea, it should be independent, on these two last ones. So if we have the stress strain index and the cross-linking, we should have an increase. So we did two experiments. One, we evaluated the patient pre and post cross-linking with stress strain index, and then we evaluated if the stiffening effect is correlated with the flattening. This is still ongoing. But the first one, we had very good results. So we have seen that the stress strain index was significantly changed after surgery. This is still unpublished, but we're going to publish this very soon. So we have more and more evidence that we are able to see the change in stress strain after cross-linking with an air pulse tonometer. And this is the unpublished data, seeing that we did see some correlation between the change in stiffness, meaning when the cornea gets stiffer, we have also seen that the Kmax gets less. I think I do see some question, but let me finish and then we will stop for question if you want. Let me show you something in clinical practice. So why is it important to do another study? As you can see, we worked a lot. If you want to know if a cornea gets stiffer over time, you need to know how much is the noise. What does it mean? If you do two measurements of any kind, even how tall is a person, but you don't know how noisy is your measurement, you don't know if this person, you see it in two different months, if you see a difference of 5 centimeters, but your system is very noisy, you don't know if that change is significant. So the first thing we did is we have seen how much noisy was the measurement of biomechanics. And with that, we were able to create a confidence interval, which means that we know that if it gets stiffer more than that, it means that it's significant. This is how it looks, for example, in the display that I will show you in a second, the change in biomechanics. So this is the stress strain curve between B and A, so two different time points. And here you can see that it's stiffer because it's higher than 2 standard deviations. And this is how it looks. So this is the biomechanical comparison display, which is available on the CorVis software. You see CorVis at November and December of 2011. You can see that deformation amplitude ratio, integrated radius, stiffness parameter, and stress strain index are all getting stiffer 1 month after cross-linking. And this is how it looks, you see? So this is pre and this is post, which means it's stiffer. Now I'll show you a very nice case report that was given with courtesy of Dresden University. So this is a patient that got worse before cross-linking. But let's see biomechanics. You can see that also the cornea in this case got softer, which does make sense. So there is significant softening before cross-linking. And then you do cross-linking, the cornea gets steeper, as we expect. And post cross-linking, you see that the cornea gets stiffer over time. And guess what? After 6 months, you have a flattening of the cone, which is in agreement with the previous stiffening. So in conclusion, biomechanical comparison display will help us to follow up patients, for example, in keratoconus, post cross-linking, post intracorneal links, and after laser vision correction. And the stress strain measurement will help us to understand the intrinsic material properties of the cornea. So I will stop now because I think this was very dense already. I do have another talk that I should give, but maybe there are some questions which I'm happy to have.
So thank you, Dr. Reccardo, for your talk. And there are some